So again, no other questions at this point.
This will be our final module, and this module is going to talk about the options for implementation of the new school-based service delivery. Who needs this information? Special education directors, potentially superintendents, and Medicaid billing staff. This module is designed to provide implementation options for school-based services. We'll look at implementation considerations, 3 potential implementation options for districts to look at how they might transition between the 2 different systems. Each module is set up with the same format to be used by districts to train their staff on school-based Medicaid services. Each module will have a PowerPoint presentation, speaker notes, and supporting documents. And the previous slide identified who would benefit from this module. So implementation consideration. Districts are going to need to evaluate their school district staff and determine who qualifies to provide the new services. Look at their qualification of teachers, paraprofessionals, school psychologists, and related service providers to see if they meet the qualifications to provide the new school-based services. Other implementation consideration is staff and parent training on the new school-based Medicaid services. How does the district plan to train their teachers on the new QIDP, and if the district's going to choose to bill QIDP? School psychologists, do they understand the new professional versus paraprofessional delivery service of behavioral intervention? Does your district have the qualifications within the district to provide behavioral consultation? Or potentially do you need to be looking at contracting that with a community provider? Does your district have a nurse? How do you train your district nurse to use the new PCS assessment? Or potentially, do you need to contract with a PCS community nurse to be doing those assessments and quarterly reviews? Again, look at your service providers and your Medicaid billing staff. But again, how do we start relaying this change to parents? How do we get parents to understand that as developmental disabilities goes away, the needs identified on a student IEP is still going to be provided within a school setting. However, you're not going to be billing developmental therapy after this school year. In addition, we'll be talking about developing relationships with contact personnel if necessary to provide school-based Medicaid services, the behavioral interventionist, the behavioral consultant, and potentially the nurses. Also needs to be considered during the implementation time is, will your district develop forms? Will they look at using the developed school-based Medicaid evaluation and IEP form? How do you share this information with your IEP software systems for uploading and incorporation if your district makes the choice to use the new evaluation or IEP forms?
One thing important to keep in mind is that particularly for if you're utilizing staff within your district to bill your Medicaid services, and even if you are using a contracted Medicaid billing service, it is very important during this transition period over the course of this year and through July 1st of next year that you have someone in your district essentially designated as your Medicaid expert and is designated to try to stay on top of the changes as they're coming down. Again, these rules for behavior intervention and behavior consultation are in a proposed form. It is anticipated that as they're submitted to the legislature, we're not expecting massive changes to them, but there could be some minor changes that could impact practice in certain ways. So again, it's very critical that you have an individual or maybe even more than one person in your district that's been designated to be checking not only the school-based Medicaid portal on the Idaho Training Clearinghouse, but the school-based services website on Medicaid, as well as the Medicaid newsletter. And we understand that's a lot of different places to be keeping on top of information, but again, it's just very critical during this time of transition that you have people who are staying on top. The last thing that we want to have happen is for districts to get caught in a potential payback situation because they missed some change in the rule. Again, it's wherever possible, we have tried to give you the specific ADAPA reference and code for everything that we have shared today. And again, as any of those things change, they will be updated on the ITC School-Based Medicaid Learning Community. So we wanted to give you some potential scenarios, and again, these are strictly potential scenarios to consider in terms of the implementation or the change process for this coming year. So we have 3 different scenarios to share with you. The first one is that you would just not do anything, your district wouldn't do anything until after June 30th. On the pro side of this is that it would be post-legislative session, so that you would be able to see what happens with those rules prior to doing anything in regards to implementation. You could wait and see what other districts do in regards to forms or procedures and essentially kind of don't try to reinvent the wheel. It would also reduce the confusion on the IEPs as to what services are being provided, and as well it would give schools 1 year to prep parents and staff in regards to the change. On the negative side of that is that if the district wants to bill Medicaid developmental disability services for behavior intervention or behavior consultation, anything after June 30th on an IEP, it would require amendment of those IEPs, which would include parent meetings to change those IEPs. For some districts, this could be a large number of IEPs, because any IEP that had been written from September forwards to June would need to be amended to reflect any new services that you would be intending on billing for beginning September of 2013, even August of 2013. It also would mean, could mean a potential loss of Medicaid reimbursement until all those IEPs were amended. And finally, it would limit pre-planning for fiscal impact with those Medicaid billing changes. In the second scenario, your district could consider not doing anything until the ADAPA rule is adopted, which would be potentially sometime in January when the legislature convenes and those rules are presented to them. In that scenario, again, not doing anything until roughly January. Again, the positives would be that you would be waiting until the semester is over, roughly, to make any changes. The IEPs from mid-January forward would reflect the current and proposed services, so the IEPs could document not only what your district would currently be providing, but also what you would start providing beginning in with the new school year of 2013. It would give your district time to develop policies, forms, and procedures to train your staff between now and roughly mid-January, and would also mean that a ADAPA rule had been adopted before those changes would occur. The cons, the negative side of not doing anything until roughly January or when the legislature approves them, is that the IEPs from August of 2012 through that mid-January would still require amendment, depending on the services that you would be looking at providing after July. And then also there would be potential confusion in regarding writing those IEPs with the current and proposed services. Again, your teams would be need to be fairly clear on how they would be documenting those services. In scenario number 3, it would be essentially that you would be implementing procedures to transition to the new services as soon as possible, as soon as your district felt you could start doing that, whether it was immediately or in a month or so. Obviously, the positive side of that is that the majority of your IEPs during the 2012 and 2013 school year would reflect current and proposed services beginning after July of 2013. It would minimize the potential number of amendments as well as the potential loss of Medicaid billable reimbursement. The negatives to that would be that, again, any IEP, that would not be a con, because you wouldn't really need to be looking at amending any IEPs. There would be potential confusion in writing those IEPs with the current and proposed services. Again, your staff would need to be fairly fluid in being able to document what you're currently providing as well as what would begin to be provided in July. It would mean a very limited time to develop training for your staff and parents, including whatever forms you might need or procedures. And then the biggest negative at this point would be that rules have not actually been adopted at this point in time. So you would be potentially writing IEPs, including services, and informing parents of services based on proposed and temporary rules. But again, we wanted to kind of just walk you through some potential scenarios so that you could look at what you were going to be doing between now and July of next year. Obviously, there's potential for any combination of those 3 scenarios as well.
So with all of that being said, the biggest thing you need to be aware of is we will be keeping the Idaho Training Clearinghouses up to date as possible to reflect the changes that are happening in regard to the school-based Medicaid rules. There is an ongoing Medicaid advisory group and a Medicaid work group that have worked diligently over the last 2 years to provide as much guidance towards these rules as possible. We know that they are not perfect in their entirety. That's why we advise you to attend one of the public meetings, get a copy of the proposed rules, read them, provide written comment, keep up to date on what is posted on the Idaho Training Clearinghouse, submit frequently asked questions so we can develop additional training for your district, provide suggestions or options on what your district's thinking of doing to kind of have a conversation with other districts and special ed directors on what's going to benefit your district and other districts as this rollout goes on. Have conversations at your regional directors meetings on problem solving what might work well within your region. I will be available to provide some guidance and training given it works for your district and for my schedule. Since there are a lot of you out there, we felt that providing these chunked out modules would give you some basis of information to start training your staff. Additional support, you can contact me at the State Department of Ed or through the Idaho Training Clearinghouse, and we can develop what hopefully will meet your district's needs. Right now we're going to open it up